the infections caused by the antibiotic-resistant bacteria can be difficult, and sometimes it's impossible to treat. So, in many cases, antibiotic-resistant infections require extended hospital stays, additional follow-up physician visits, and expensive toxic alternatives. And what we learn in class can be solved this problem is that the money the people spend on the antibiotics is private cost. Yet the title talks about the new bacteria they are involving and can become resistant to drugs. So this will bring negative externalities, which will lead to additional cost, as known as the external cost, and the social cost will be raised as well. While the number of antibiotics will become less and less, which is not good for the society, medicine, and the people need antibiotics. So economists will classify this as a negative externalities. So the solutions is that in economics, they will focus on the approach tends to be on developing policy response that internalize the externalities of resistance. In the case of antimicrobial resistance, this means, for example, providing incentive of consumers, prescribers, and producers to take into account the potential externality cost of the antimicrobial consumption to society. We also can do this by reducing the problem of inappropriate antibiotic use. Requires a combination of price and non-price measures with patient and physician education, better data on monitoring, and the provision of warning labels on antibiotics all being a part of the policy mix. But however, without a compelling economic incentive for patients and the physician to impose costs on the rest of society in the form of resistance, when antibiotics are used or misused, they are likely to be effective on the medicine factors. Thank you.